Hi everyone, this is Dr. Bashi, and what I'm going to do today is explain some of the different properties of fillers. We have actually over here the Allergan portfolio of fillers. We can see over here we've got Voluma, we have Vollure, we have Volbella, we have Ultra Plus XC and Ultra XC. And Allergan actually gives a small little sample to new accounts. We've had this for quite some time, and if you feel it, you can actually feel the differences in the properties of the fillers based on how dense the fillers are and how well these fillers support each other. For the filler newbies, the first thing you should realize is that all fillers are not necessarily created equal. Their functions are different. So for example, over here we have Voluma. We can see Voluma is the stiffest of the different Allergan fillers that we have here. The Voluma is designed primarily to be put on bone. So not surprisingly, we see it really resisting a lot of movement, resisting a lot of motion. This filler here is designed to be put on bone, on chin, on jaw, on cheek, inside the temples, etc. As we go over, when we look at the Vycross technology, we see the Vollure has a lot more give. And if you think about the difference between these two products here, right? This is very stiff and this has a lot more give. And the Volbella has even more give. If you can see, there's almost no resistance to the Volbella when I really push on it versus the Vollure, which has a little bit more, and then the Voluma, which is pretty stiff. If you think about what parts of the face move a lot versus what parts of the face don't move a lot, you can see why you want to place the stiffest filler on the part of the face that moves the least, which is the bone. So I like to use the Voluma on the chin, on the jawline, on the cheeks, in the temples, etc., etc. I primarily place this product on bone, on areas that don't move. Now, the Vollure is kind of an in-between product. You can see the amount of give that the Vollure has when I'm pressing on it. This product is designed for mobile areas of the face. So I like to use the Vollure, let's say, sort of underneath the cheek area. I like to use it around the mouth. I sometimes even use this in the lips. And quite frankly, I use this in the lips a lot. But you could see how it's designed for mobile areas. The Volbella is designed for very, very thin areas or very hypermobile areas or even areas of mucosa. So the Volbella is primarily going to be used along the cutaneous lip or the red lip or in very hypermobile areas, the vertical lip lines and so on and so forth. So in terms of the Vycross technology, I like to use Voluma, Vollure, Volbella primarily. Now, one thing you should know about the Vycross technology, some studies have shown an increased rate of granulomas with Vycross technology. So that's one thing to take into consideration. The other thing to be, really knowledgeable about is generally your Vycross technology will last a little bit longer. Also, it's hard to reverse. It's harder to reverse. You may need to use Hylenex a couple of times to reverse it. Here we have Ultra Pulse XC and Ultra XC. These are great products as well. This is primarily the older generation of products. I don't really use these products all that much, but these are great products if you want to create a lot of size in the lip or you have nasolabial folds that need a lot of filling. But primarily in my practice, I tend to use Voluma, Vollure, and Volbella almost exclusively. So again, you have the Vycross technology, you have the non-Vycross technology, and you have different properties of fillers, different rheological properties of fillers that make them useful for different areas of the body, different areas of the face, etc., etc. So, if you're going to be placing Volbella on bone, you're going to be wasting that Volbella. You're not going to be able to create a significant lift. Your patient will be disappointed. Similarly, if you use Voluma in the lips or underneath in the under eye, you may have a disappointed patient. Although I will say a lot of my colleagues do use Voluma in the lips and in the under eye. I personally do not use it. I use Voluma primarily as a tacking filler on bone or to recreate bone. Again, jawline, chin, etc. For me, Vollure is primarily an area where I use the filler where things are mobile, and Volbella where things are either very, very thin or very, very hypermobile. In the next part of the video, what I'll do is I'll actually open one of the Ultra Plus XCs and I'll show you some of the rheological properties of filler. I'll compare it to other kinds of gels and ointments and things so you can kind of get a sense of what this looks like when you feel it in your hands.